Good evening. I'm CS Nandri Vignesh. Today we are presenting ultrasonic diathermy. So, what is ultrasonic diathermy? Diathermy is a therapeutic treatment that uses high frequency energy or sound to generate deep therapeutic heat within body tissues. Unlike superficial heating modalities like hot packs, diathermy can penetrate several centimeters deep, reaching muscles, tendons, ligaments, and joint capsules. So, what is the primary use? It is a cornerstone of physical therapy and sports medicine, primarily used to relieve chronic pain, relax muscle spasms, and promote the healing of soft tissue injuries. So, what are the types of diathermy? Shortwave diathermy, microwave diathermy, and at last the ultrasonic diathermy, on which we will be focusing on today. The principle and applications. Primarily, the ultrasonic diathermy works on the principle of piezoelectric effect. It is the ability of certain materials, like the crystals inside the ultrasonic transducer, to generate an electrical charge in response to applied mechanical stress, and conversely, to undergo a mechanical deformation when an electric voltage is applied. Next is how does absorption and friction play its role? The, the coupling gel is applied to the skin to ensure these sound waves efficiently enter the body. As the waves travel through the deep tissues, especially those rich in collagen like muscles, tendons, ligaments, they cause the tissue molecules to vibrate. The friction from this microscopic movement is what converts the sound energy into therapeutic heat. Working of ultrasonic diatherapy. The process begins when an electrical current is sent from main unit to a specialized crystal, that is the transducer, in the handle applicator. This crystal has that unique property. The electricity causes it to vibrate rapidly due to the piezoelectric effect as discussed earlier. This vibration generates high frequency sound waves far above the range of human hearing. At last, the mathematical relation and dosage. As you can see, this formula, that is heat directly proportional to I dot into alpha into T. Here I is the intensity of the ultrasonic wave measured in watt per centimeter square. This is the power per unit area and is directly controlled by the therapist. Alpha, the absorption coefficient of the tissue. This is a constant unique to it. This constant is unique to each type of tissues. It represents how efficiently a tissue converts ultrasound energy into heat. Tissues with high collagen content, for example, the bone, tendons, ligaments, have a much higher alpha, and therefore absorb more energy and heat up faster than the tissues with higher water content, for example, the fat. Next, T is the time, the duration of the treatment. Thank you.
So, hello, my name is Alan Sunny. I'll be talking about the application process. These are three critical steps for correctly applied therapeutic ultrasound. The first process is coupling gel application. The first step is to apply liberal amount of coupling gel to the patient's skin over the area that will be treated. This is typically a water-based hypoallergenic substance. The high frequency sound waves like those used in ultrasound do not travel well through the air. If there were an air gap between a transducer head and the skin, over 99% of the sound energy would be reflected away and would never enter the body. This gel has an acoustic impedance similar to that of the human tissue, which minimizes the reflection and maximizes the transmission of the ultrasound waves. The second is the transducer contact. Once this gel is applied, the therapist places the transducer head directly onto the gelled area, ensuring firm and even contact with the skin. It must be placed flat against the skin surface. Maintaining full contact is crucial throughout the treatment. If part of transducer head lifts off the skin, an air gap is created and energy transmission will be lost in that area. The third is the constant motion. This is the most critical step for the patient safety. Therapist must keep the transducer head in slow, continuous motion throughout the duration of the treatment. The transducer is typically moved in small, overlapping circles or slow stroking patterns over the treatment area. This is to prevent burns by keeping the transducer Translucent constant motion, the therapist ensures that the ultrasonic energy is distributed evenly across the entire treatment area, preventing any single point from overheating. The next part is frequency and depth. Here, this slide talks about the fundamental principles of therapeutic ultrasound, the relationship between frequency of sound wave and a depth. It can penetrate into the body's tissues. The first is the 1 megahertz frequency. This frequency is capable of traveling deep into the body, reaching depths of up to 5 centimeters. Its lower frequency, its energy is absorbed more slowly by the tissues, allowing it to bypass the superficial layers and deliver its therapeutic effect to deeper structures. This makes 1 megahertz the ideal choice for treating large, deep muscle groups and tissues, such as the quadriceps, large muscles on the front of the thigh, the rotator cuff, a group of muscles and tendons deep within the shoulder joint. The second is 3 megahertz frequency, which is the highest frequency. It is absorbed very quickly, penetrating only to a superficial depth of about 1 to 2 centimeters. Mostly the clinical applications are for the Achilles tendon. This tendon is very superficial in the back of the ankle or a wrist ligaments. Mainly important ligaments in the wrist are located just under the skin. Using 3 megahertz for these areas allows to concentrate therapeutic energy exactly where the injury is without unnecessarily heating the deeper tissues. Thank you.
Effectiveness of the therapy depends on the therapist setting the correct parameters for a specific condition. First one, frequency. As we covered, that determines the depth of treatment. 1 MHz is for deep tissues and 3 MHz is for superficial ones. 2. Intensity. This controls the rate of heating. High intensity produces heat more quickly. The therapist chooses this based on the treatment goal and patient feedback. And the third, duty cycle. This determines if the treatment is thermal or non-thermal. Continuous 100% is used for heating effects. Pulsed minimizes the heat and is used for mechanical effects like reducing swelling. Fourth one is duration. The length of the treatment typically between 5 to 10 minutes depending on the size of the area and the intensity used. Safety first. Contradictions. Contradictions are conditions where ultrasonic diathermy must not be used because it could be harmful. Overtumors. The increased blood flow and metabolic activity could potentially accelerate tumor growth. For a pregnant uterus, the effects of developing fetus are unknown and the risk is too high. Over pacemakers. The ultrasound's energy can interfere with the electronic circuitry of an implanted device. Over infection or blood clots. The increased circulation could spread the infection or dislodge a blood clot, which can be life threatening. Over the eyes of reproductive organs. These areas are highly sensitive and can be easily damaged by the ultrasonic energy. Precautions. Keep the transducer moving, prevent localized overheating and tissue burns. Apply conductive gel, ensures even ultrasound transmission, reduces skin irritation and device overheating. Avoid confidential area, never treat over the eyes. Reproductive organ, brain, head, spinal cord, bony prominences, tumors, infection or open wounds. No use with metal or electronic implants. Remove jewelry, avoid areas with pacemakers, metal plates, neurosimulators, risk of severe injury. Not for acute injuries or areas with impaired sensation or circulation. It can worsen inflammation or go undetected if the patient can feel the pain. Monitor patient's response. Stop immediately if there is pain, tingling, discomfort, or skin redness.